Hello friends, and welcome back to the channel. My name is Dinesh and I am a physiotherapist. Today, we are going to talk about something that many of you experience every single day, perhaps without even knowing its name: trigger points. Have you ever felt a small, painful knot in your muscles? One that's tender to the touch and sometimes sends pain to other parts of your body? That, my friends, is a trigger point. These are essentially tiny contraction knots in your muscle tissue that can cause a surprising amount of discomfort, stiffness, and referred pain, often mimicking other conditions. They can be a real source of chronic pain and frustration for many people. These trigger points can develop for many reasons, from stress and poor posture while working at a desk to overexertion during exercise, or even from an old injury that never fully healed. The problem is that these knots don't just stay localized. They can refer pain to distant areas, which is why your headache might actually be coming from a knot in your neck, or why that pain in your arm could be originating from your shoulder blade. It can be a confusing and difficult puzzle to solve on your own, leaving you feeling helpless against this persistent ache that just won't seem to go away, no matter how much you rest. But here is the good news. You don't have to live with this discomfort. In today's video, I'm going to guide you through some of the most common trigger points that I see in my clinic every day. I will show you exactly where to find them, what symptoms they typically cause, and most importantly, I'll teach you simple and effective techniques to release them yourself, right from the comfort of your own home. We will unlock your body and help you find relief. So, let's get started and learn how to manage these troublesome knots together. Let's begin with one of the most common culprits I encounter, the upper trapezius trigger point. This large muscle spans from the base of your skull, across the back of your neck, and out to your shoulders. It's the muscle that often feels tight and sore after a long day of sitting at a computer or from carrying heavy bags. The primary trigger point is usually found in the fleshy part of the muscle, right between your neck and the point of your shoulder. When this point is active, it doesn't just cause local pain. It famously refers pain up the side of the neck and into the temple, creating what is often mistaken for a tension headache. You might also feel a deep, aching pain in the back of your eye. The symptoms can be quite distinct. Many of my patients describe it as a constant nagging ache that makes it difficult to concentrate. They might also experience stiffness in their neck, making it uncomfortable to turn their head from side to side. If you press on that spot and it reproduces that familiar headache pattern, you've likely found your target. This trigger point is often aggravated by emotional stress, which causes us to unconsciously shrug our shoulders, keeping the muscle in a state of constant tension. Over time, this sustained contraction leads to the formation of these painful knots, creating a vicious cycle of pain and tension. To release this trigger point, we can use a very simple and effective technique. Sit in a comfortable chair with good posture. Take your opposite hand, so if you're working on your right shoulder, use your left hand and reach over. Use your fingers to find that tender, ropey band of muscle. Once you've located the most tender spot, apply gentle but firm pressure directly onto it. You don't want to cause sharp pain, just a good hurt. Hold this pressure for about 30 to 60 seconds. While holding, you can gently tilt your head away from the shoulder you are working on to deepen the stretch. Breathe deeply and try to relax into the pressure. You might feel the knot start to soften or even melt away. Repeat this a few times a day to find lasting relief. Next, we move to a small but mighty muscle that is a frequent source of neck pain and stiffness, the levator scapulae. As its name suggests, this muscle's main job is to elevate or lift your scapula, which is your shoulder blade. It runs from the top corner of your shoulder blade up to the vertebrae in your neck. A trigger point here is notorious for causing that classic stiff neck feeling where you wake up and can't turn your head to one side without a sharp catching pain. It feels like you've slept wrong, but often it's this trigger point that has become aggravated. The primary trigger point for the levator scapulae is located at the top, inner corner of your shoulder blade. It can feel like a deep burning ache right at the angle of your neck and shoulder. The pain from this spot often stays concentrated in that area, but it can also refer down the inside border of the shoulder blade. A key sign that this muscle is the problem is a significant limitation in your neck's rotation. You might find yourself turning your whole body to look over your shoulder instead of just your head. This trigger point is commonly activated by activities like holding a phone between your ear and shoulder, sleeping with your head in an awkward position, or even shivering from the cold. Holding a phone between your ear and shoulder, sleeping with your head in an awkward position, shivering from the cold. To release this tricky spot, we can use a technique similar to the one for the trapezius, but with a slight modification. Again, sit upright in a chair. Using your opposite hand, reach over your shoulder and feel for the very top inside corner of your shoulder blade. It's a bit deeper, so you may need to press firmly to find it. Once you locate that tender spot, apply sustained pressure. Now, to enhance the release, gently drop your chin towards your chest and then turn your head away from the side you are working on, as if you are trying to look at your opposite armpit. This position puts the levator scapulae on a stretch, making the release more effective. Hold this for 30 to 60 seconds, remembering to breathe and repeat as needed throughout the day. Let's now turn our attention to the shoulder and a muscle that is a very common yet often overlooked source of shoulder pain, the infraspinatus. This muscle is one of the 4 rotator cuff muscles, and it covers the lower part of your shoulder blade. Its main job is to rotate your arm outwards. Because of its constant use in stabilizing the shoulder joint during almost all arm movements, it's highly susceptible to developing trigger points. Many people who complain of a deep aching pain in the front of their shoulder are surprised to learn that the source is actually a trigger point in the back. The trigger points in the infraspinatus are typically found in the main belly of the muscle, right on your shoulder blade below the bony spine you can feel running across it. The referred pain pattern is what makes this one so tricky. It often sends a deep, persistent ache into the front of the shoulder joint, sometimes extending down the side of the arm and even into the hand, mimicking conditions like bicipital tendonitis or even carpal tunnel syndrome. You might also experience weakness when trying to reach backwards or lift objects. This trigger point can be activated by activities like throwing a ball, painting a ceiling, or even just sleeping on your side with your arm in an awkward position. Releasing the infraspinatus can be a little difficult to do with just your fingers, so I recommend using a tool like a tennis ball or a lacrosse ball. Stand with your back to a wall and place the ball between the wall and your shoulder blade. Position the ball directly over the tender spots you find in the infraspinatus muscle. By leaning your body weight into the ball, you can apply deep, sustained pressure. Gently roll the ball around to hunt for those knots. Once you find a particularly tender spot, hold the pressure there for 30 to 60 seconds until you feel the muscle release. You can also add a gentle crossbody stretch with your arm to intensify the release. This is a fantastic way to address that deep, nagging shoulder pain. Moving down the body, we arrive at a very important muscle for stability and movement, the gluteus medius. This muscle is located on the outer surface of your hip, just below the crest of your pelvis. It plays a crucial role in stabilizing your pelvis when you walk, run, or stand on one leg. When this muscle is weak or contains trigger points, it can lead to a cascade of problems, including low back pain, hip pain, and even pain that radiates down the leg, a condition often misdiagnosed as sciatica. It's a key muscle that I always assess when a patient presents with lower back issues. The trigger points in the gluteus medius are usually found in the upper fleshy part of the buttock, just below the bony ridge of your hip. When you press on these points, they can be exquisitely tender and can refer pain directly into the lower back, across the buttock, and sometimes down the outside of the thigh. A common complaint from patients with active gluteus medius trigger points is pain when lying on their side at night, pain when walking, or pain that gets worse after prolonged sitting. This is because a weak gluteus medius can cause other muscles, like those in your lower back, to overwork and become painful. To release this powerful muscle, a foam roller or a massage ball is your best friend. Let's demonstrate with a ball. Sit on the floor and place the ball under the buttock of the affected side. You'll need to support yourself with your hands behind you. Bend your knees and cross the ankle of the affected side over the opposite knee, which will help to stretch the muscle and expose the trigger points more effectively. Now, gently roll your body over the ball until you find those tender spots. When you locate a knot, pause and hold the pressure, allowing your body weight to sink into the ball. Hold for 30 to 60 seconds, breathing deeply. This can be intense, so start gently and gradually increase the pressure as you feel the muscle begin to release. Finally, let's address a trigger point that can affect your entire lower body's movement, the gastrocnemius, or your main calf muscle. This is the large, two-headed muscle on the back of your lower leg that forms the bulk of your calf. It's essential for walking, running, and jumping as it helps to point your foot downwards. Trigger points in the calf are incredibly common, especially in runners or people who wear high heels, but they can affect anyone. These knots can cause not only local calf pain, but can also refer pain to surprising areas, like the arch of your foot. The most common trigger point in the gastrocnemius is located high up in the fleshy muscular part of the calf, just below the back of the knee. When this trigger point is active, it can cause a deep ache or cramping sensation in the calf itself. Sometimes, the pain is felt most intensely when walking, especially when pushing off your toes. A key referred pain pattern from this trigger point is pain in the instep, or the arch of the foot, which can often be mistaken for plantar fasciitis. It can also lead to nighttime calf cramps that can be very disruptive to your sleep. These trigger points are often caused by overuse, sudden changes in activity level, or even dehydration. A straightforward way to release this muscle is by using your own hands or a foam roller. To use your hands, sit on the floor with your leg outstretched. Grab your calf with both hands and use your thumbs to press deeply into the muscle belly, searching for those tender ropey knots. When you find one, apply sustained deep pressure for 30 to 60 seconds. Alternatively, you can sit on the floor and place a foam roller under your calf. Support your body with your hands and gently roll your calf back and forth over the roller. To increase the pressure, you can cross your other leg over the top. When you find a tender spot, pause and hold, and you can even point and flex your foot to help the muscle release more effectively. So there you have it, friends. A guided tour of 5 of the most common trigger points and simple techniques you can use to start finding relief today. Remember that consistency is key. Releasing these knots is not always a one-time fix. It often requires regular attention, especially if the underlying causes like posture or stress are still present in your daily life. I encourage you to gently try these techniques and listen to your body. Pay attention to how it responds. You have the power to understand your body's signals and take an active role in your own well-being, and that is a truly wonderful thing. However, it is very important to remember that while these self-release techniques are incredibly helpful for managing muscular aches and pains, they are not a substitute for a professional diagnosis. If your pain is severe, if it persists despite your best efforts, or if you are unsure about the source of your pain, please do the right thing for your health and consult with a qualified physiotherapist or your doctor. They can provide a thorough assessment to ensure you are on the correct treatment path and rule out any more serious conditions. Your health is your most valuable asset, so please take care of it. Thank you so much for joining me today and for investing this time in your health. I truly hope you found this information valuable and that it helps you on your journey to a more comfortable, pain-free life. If you enjoyed this video and want to learn more about how your body works and how to take care of it, please consider liking this video and subscribing to the channel. Don't forget to hit the notification bell so you won't miss any future content. Until next time, stay active, stay healthy, and be well.